Environ Life Science Limited, partnering for life.
Hi, I'm Dr. Harish, your board certified plastic surgeon. So today I'm going to be talking about gynecomastia. It is also known as man boobs or moobs. So this by definition is the abnormal enlargement of one or both breast tissue in males due to multiple factors. One of the most common being an imbalance between your male hormone, that is testosterone, and female hormone, that is estrogen. Gynecomastia is the most common benign disorder of the male breast in the world, and it affects approximately 35% of men, being most prevalent in the age group between 50 and 70 years. It is normal for up to 70% of adolescent boys to develop gynecomastia to a certain degree. Of these 70% of the adolescents, 75% of it may resolve without any intervention of any sort. If the condition does not resolve within 2 years, then it usually causes a lot of psychosocial disturbances in the adolescent, and therefore the treatment is warranted even in adolescents. So medical treatment that usually persists beyond 2 years is ineffective, and there are a lot of differences between gynecomastia and pseudogynecomastia, which I'll be discussing further. So how do you know if you or anyone you know has gynecomastia? What are the signs and symptoms? In gynecomastia, there is always enlargement of either one or both the breast tissue. It can be symmetrical or asymmetrical. There'll be a soft, compressible and mobile mass of breast tissue that is felt under the nipple of the male. It may feel like a mass too. It can also be associated with tenderness and a little bit of nipple sensitivity, which is typical of gynecomastia, especially in adolescence or if there is early in development. And usually it is not painful or rapidly growing, and there may not be masses in other areas associated with gynecomastia. It is painful, or if there's any amount of nipple discharge or some kind of skin puckering, then it's highly recommended to consult a physician. And apart from that, as I already told you, gynecomastia has severe psychosocial implications. It can lead to a bad self-esteem, it can lead to confidence issues, it can lead to not participating in activities at the school or even in public places such as swimming or in the changing room and lockers. Child or the adult may be very self-conscious and therefore not partake in any of these social activities. Cause of gynecomastia is not known in almost 25% of the cases, but in the rest of the cases it is thought to be due to an alteration in the ratio of testosterone and estrogen. That is, it can either be a reduction in the male hormone testosterone or an increase in the female hormone estrogen due to any reason, or it can also be because of a combination of these two. Gynecomastia doesn't necessarily have to be pathological. That is, it may occur even physiologically. That is, normally at 3 points in your life. One of it is in infant males. So this is one part. The second one is during adolescence, just around puberty. And lastly, in elderly men above the age of 55 or 60, it can occur physiologically. In neonates, 60 to 90% of both male and female neonates can be born with an enlargement of the breast tissue. This happens because in the mother, the placenta converts certain hormones into breast enlarging hormones, and therefore this projects itself as gynecomastia. But in all the cases at this age, it is physiological and it usually resolves within 2 to 3 weeks. In adolescence, the main reason is hormonal imbalance. So it can occur up to 65% of adolescents as early as the age of 10 years, and it can peak at 13 to 14 years of age, which is a little traumatic psychologically to the child, and it can cause a lot of issues. But in almost 80% of pubertal or adolescent age group gynecomastia, it is self-limiting, and almost all of them resolve within 1 to 3 years as pubertal progression increases the testosterone levels, and whatever hormonal imbalance may have caused this issue gets regressed or reversed by that age. And by age 17 or by age 18 years, gynecomastia resolves in such a way that only 10% may have persistent gynecomastia, which may need treatment. And the last physiological gynecomastia, which happens due to old age, is mainly because of a physiological decline in testosterone. So when testosterone, the male hormone, reduces, then there is also going to be other components such as a reduction in the total muscle mass and an increase in the fatty tissue. Now, when the fatty tissue increases, the individual develops other issues which convert your male hormone into female hormones. So again, this physiological response due to age, which is normal, presents itself in such a way that the fatty tissue around the breasts start increasing, and this also can be treated surgically, but it is a part of physiological gynecomastia which will not go away on its own. So almost 25 to 65% prevalence of this gynecomastia in this community of elderly men. So coming to pathological or non-physiological gynecomastia, almost 10 to 25% of gynecomastia causes are because of the intake of certain medication. So what are these exogenous chemicals that cause gynecomastia? So scientifically proven drugs such as ketoconazole, cimetidine, there are certain antifungal drugs which in the long term can cause this. There is GnRH, the gonadotropin releasing hormones, which may be advised to you by endocrinologists. There may be drugs such known as 5-alpha reductase inhibitors such as finasteride, dutasteride. Some of it is given in view of correcting your benign prostatic hypertrophy. Some of it may be given for your hair loss by certain surgeons. So these drugs can cause a significant amount of gynecomastia, mainly because of a hormone imbalance. Malnutrition and significant loss of body fat, which is over and above the normal recommendation, can lead to a suppression of your gonads, of your sex hormones, as well as lead to a condition known as hypogonadism. So this can also a major cause for gynecomastia, which is known as refeeding gynecomastia. But unlike the other surgical causes, this can resolve on its own, just like. Apart from this, there is also chronic conditions such as chronic liver disease, chronic renal failure, and also conditions such as ulcerative colitis and cystic fibrosis. Somehow these disorders cause disruption in the normal androgen to estrogen ratio, and this causes gynecomastia. So if your plastic surgeon asks for investigations such as liver function test or anything else, it is usually to diagnose these underlying conditions which can be triggering your gynecomastia. So gynecomastia is not a purely surgical problem in all cases. It needs to be figured out. Your differential diagnosis needs to be completely ruled out, and then only your surgeon can take a decision. So how is gynecomastia diagnosed? Usually it is a clinical diagnosis. Your surgeon would examine the breast, palpate it for any other conditions, lumps, asymmetry, your NAC, sensitivity, everything would be first taken into account. After that, few tests such as liver function tests, your blood routine, your preoperative OT panel investigations would be done. Very rarely in certain situations your plastic surgeon may ask you for extra investigations. These extra investigations may be an ultrasound, it may be your beta HCG, testosterone, estradiol, and so on. So this depends on your presentation, depends on what your surgeon is suspecting, and then only the surgery, if required, is done. Before we go to the treatment part, we need to understand that there are 4 classes. There are multiple classification systems, but one of them is a simple grading system where you may have a minor enlargement, moderate enlargement, a moderate enlargement without and with skin excess, that is. So that is 2 and 3. And then there is a marked enlargement with skin excess. So grade 4 would be a typical feminine type of breast. Grade 1 would be just a minor enlargement with no skin excess. Coming to treatment, so there is a medical form of treatment, but that is only if your gynecomastia is secondary to some other underlying problem. So by treating the underlying problem, your gynecomastia is automatically corrected. But in most of the cases, it is idiopathic and there won't be any other underlying reason for gynecomastia. In those cases, what we do is a liposuction with a lipoglandular excision. So the liposuction is something that we go through with a small cannula, and all the fat around the gland is completely sucked out. And after that, the glandular tissue, which does not come out through liposuction, is completely excised through a very, very small, I would say 0.5 to 1 centimeter incision just around the areola. The advantage of this is that it's completely hidden, both the incisions where we pass the cannula, liposuction cannula, as well as the incision for the lipoglandular excision are both completely hidden. In most cases, they heal well. 99% of the cases heal well without any scars. Surgery is fairly simple. It is a daycare procedure. You can get admitted in the morning and be discharged the same day, either in the afternoon or evening, as comfortable. After the surgery, you're given certain medication which you need to be taking, like antibiotics and some painkillers. The pain is not too much and is usually handled well by most of the patients. And it reduces even further with analgesic tablets that are given. Compression garment is given to all patients and is to be worn as advised by the physician or the surgeon. You will have to be in touch with your surgeon and follow up at regular intervals. The overall prognosis for gynecomastia is very good if it is an idiopathic cause and the surgery has been done. Gynecomastia, finally, as troublesome and problematic as it may sound, the treatment for it, if investigated and evaluated in the right fashion, is fairly simple, safe, and effective. Thank you.